In the first part of this lesson, we spent some time defining what psychological help was and also the dimensions of psychological help. So let's switch gears a little bit and talk about what happens when our psychological help isn't exactly where we want it to be. College is a very common time for this to happen. So think about all the changes in college, right? So you come in, you're with a whole new group of people. There's probably more stress than you've ever felt before. There's more social pressure, academic pressure. You've got loneliness, maybe you've got financial trouble. There's just so much. So college is a really common time for us to start to see mental health issues in that age group. Now, I do want to differentiate between kind of situational anxiety, situational depression, and true mental illness. So true mental illness is defined by something that impairs functioning in daily living, right? So it disrupts your thinking and your feeling and your moods, and it makes it really difficult to get through your day. Can't get out of bed, you don't want to eat, you can't sleep, you don't want to see your friends, you socially isolate. So these are the things that would cause impairment in daily living. 1 in 5 adults actually suffer from a diagnosable mental health disorder. I'm curious if this is surprising to any of you. I think we talk about this more, and I think we're doing a good job of bringing awareness to mental health. However, if you look at the numbers that actually get treatment, which is about 43%, it's clear there's still some stigma around this and also maybe an access issue, right? So maybe people don't have access to mental health providers or don't have insurance that covers it. So there's certainly a ways to go with this issue in our country. We know that mental health concerns are common among college students. So let's make it a little bit more relevant to Wake Forest. So the data I'm going to show you here comes from the Counseling Center. So what do we think are the most common mental health concerns at Wake Forest? If you thought to yourself anxiety, you are correct. That is by far the most common thing that someone would go to the Counseling Center for, followed by depressive disorders, trauma responses. Any kind of addiction is considered a mental health disorder. As well are eating disorders, and then developmental and adjustment concerns. So this is a graph from 2008, and it shows the prevalence of serious mental illness among US adults. If you look at the blue line, it's clear that there is a higher prevalence of mental illness among females than there are of males. So think for a second to yourself, why do you think that is? Right? And lots of things might come to your mind, but I think the biggest factor here is simply that women are more likely to seek out help, right? There's less of a stigma around females seeking out help than there is with males. So this may not actually mean that women have more mental illness, but women are more often diagnosed because they're more likely to seek out that help. Your age group has the highest prevalence. Again, we talked about that mental health concerns among college students are very common. And then you can look at the disparity in race and ethnicity as well. Some interesting information pertaining to that. Racial ethnic minority groups are less likely to receive mental health care. For example, in 2015, among adults with any mental illness, 48% of whites received mental health services, compared with 31% of Blacks and Hispanics and 22% of Asians. This may be a stigma issue, this may be an access issue, but this is certainly one of those health disparities that we talked about in a previous class. These numbers come from a survey called the National College Health Assessment, and Wake Forest actually takes part in this survey. This was from the national numbers, which there were about 50,000 students surveyed nationally. So of those 50,000, 86% felt overwhelmed by all they had to do. It's a really common feeling. Probably many of you feel like that right now. 46% felt things were hopeless. 32% felt so depressed it was difficult to function. 8% actually seriously considered suicide. 6% intentionally injured themselves, and then 1% actually did attempt suicide. So these feelings in college are really, really common, right? So if you're feeling this way, if you ever feel this way, realize that there's other people that feel that way too. And that's why we have so many resources on campus. And I'll talk about our resources at the end of the presentation, but there's so many people on campus and now kind of working remotely that are more than happy to work with you if you have some of these feelings. So what contributes to mental illness? Typically, it's very multifactorial. So it certainly could be a brain structure, a brain chemistry, genetic, part of your family history. You have to think about the brain like an organ, right? The brain is an organ. Sometimes it's just not working properly. So just like if we were physically sick and we sought out help, we want to do the same if our brain isn't working as maybe it normally should. Maybe what contributes is falling outside kind of that cultural expectation of normal, right? The culture thinks we should be or act one way and we don't. That can be really stressful. So maybe it's a stress response. So I want to make it very clear that stress does not cause mental illness, right? But stress can be a very powerful trigger for anything underlying, any anxiety, any depression. Stress can be a very powerful trigger for that. But again, often mental illness is multifactorial and a combination of many of these. I'm going to go through some of the most common mental health disorders. And please realize that I am not a counselor. I'm not a psychologist. I am not trying to diagnose. I'm just giving you some kind of signs and symptoms and what these could possibly look like. So we already said that anxiety disorders are the most common mental health issue on college campuses. About 15% of college students are treated for anxiety. Probably many more actually struggle with anxiety. But anxiety, like we know, is that persistent feeling of threat and worry, and you can't cope with everyday problems. So generalized anxiety disorder is the most common anxiety disorder, and it is diagnosed when someone has these feelings of anxiety more often than not for a period of 6 months. Now, does that mean you have to wait 6 months to seek out help? Absolutely not, right? That's just the diagnostic criteria. Anytime you feel kind of out of control or out of the ordinary, or you just can't cope with things, certainly seek out help, right? The Counseling Center here at Wake Forest is a wonderful resource. So anytime you feel the need to seek out help, go for it. So chronic mood disorders, we would also call these depressive disorders. These would be the second most common mental health issue on college campuses. About 12% of college students are diagnosed with major depression in a given year. So major depression is characterized by sadness and despair. Remember, something that interferes with your daily life. So you can't concentrate, you can't think, you're anxious, you're isolated, you're tired, you can't sleep, you can't eat. I mean, those would be the things that interfere with your daily life. So major depression is characterized when someone has a bout of depression that lasts for more than 2 weeks. Again, you don't have to wait that long to seek out help. That's just the diagnostic criteria. Eating disorders are characterized as mental illnesses. They actually have the highest mortality rate, or more people will die from them than any other mental illness. And that's because there's such a strong physical aspect. And they're classified as mental illnesses because there's a psychological connection to the behavior. They're not able to think rationally about their disordered eating patterns or their very low weight status. Typically, someone who has an eating disorder has a co-occurring depression or anxiety or OCD, but another co-occurring mental illness as well. So social media depression, this is really interesting. This is not yet a diagnosis, but we do have a growing body of research that shows there's a relationship between depression and social media. So being constantly connected to social media can actually socially isolate you. It can cause you to be constantly comparing yourself to other people and berating yourself for not living up to other people. Maybe you're obsessively thinking about what you post or what someone else posted. Can certainly lead to body image concerns. So the point being, there is a connection. There is a relationship between depression, anxiety, and social media use. So if you are someone who's already vulnerable to those things, be very careful how socially connected that you let yourself be. So how is mental illness treated? Once again, I'm not a psychiatrist, I'm not a counselor, but the point is that it's typically multidisciplinary. It might involve things like psychotherapy and counseling or medications, a combination of some of these or all of these. It's not a quick fix. That's something to understand, right? It's not you go to the doctor, you get a medication, and you're better, right? Sometimes this is a long-term treatment plan. Sometimes medications take a while to work. But the point being, there is treatment. And the very first step is actually recognizing that you need that help. So if any of these things you've identified with that we've talked about, the first step is simply recognizing that you do need treatment and seeking that out. So very quickly, I want to touch on one more thing, and that's the connection between mental illness and suicide. Unfortunately, suicide is the second leading cause of death on college campuses, and Wake Forest is not immune to this. 8% of college students have considered suicide in the past year, and then 90% of those who complete suicide actually have a diagnosable mental health disorder. Often it's depression, and so there's some self-medication, some negative coping mechanisms, substance abuse, and depression. It's a really dangerous combination. So what should we look for in other people? We often call these the signs of students' distress. So the 3 A's: academics, action, and appearance. So in terms of academics, are they missing class? Are they skipping assignments? Do they just seem to not care about their work anymore? Are they expressing violence? In terms of actions, do they verbally state that they're distressed? Are they angry? Are they isolating and crying and hopeless? Do they ever express suicide? If someone ever says it, they've probably thought about it. You always want to take that seriously. Never just brush it off and say they'll be fine tomorrow, right? If they ever express it, they've probably thought about it. In terms of appearance, they look like they're hurting themselves, or they're losing weight or gaining weight, or they just don't care, they're exhausted, or poor hygiene. These are things we have to be aware of. We have to look out for each other. We're a small community. We really want to care for those around us. Sometimes people just need to know that someone cares. So what should you do if you suspect this? First of all, take it seriously. Never be afraid to voice your concern. Let someone know that you care. Ask them if they have a specific plan, right? You're not going to put that seed in their head. Just ask them. If they're willing to seek treatment, go with them, right? Take them by the hand and take them to the counseling center or the emergency room if you're able. If they don't seem to want help, still tell someone, right? That's a really big burden to keep on yourself. Call 911 if you believe they're in imminent danger. So when should you seek help? The answer is anytime you're concerned, right? Anytime you maybe feel out of the ordinary or overwhelmed or overly stressed, just reach out to some of these resources on campus. We have awesome resources, both confidential and non-confidential, and they are still operating remotely even when you're not here on campus. Any information I get on that, I will pass along as I get it. But please keep in mind, we have amazing resources that are here to help you at Wake Forest.